Good morning, everyone. Seemab Mehmood here from Pakistan. My topic of discussion is today is youth the potential factor in bridging the gap, between the planetary health and the ongoing condition of Pakistan. So I am going to talk about in reference of the Pakistan, why is it important to incorporate planetary health in Pakistan? So here we go. But before that, we need to know what is exactly planetary health is. I have, my colleagues are watching me online. So for them, what exactly planetary health is? Because once we realize the importance, before we realize the importance, we need to know what is it about, right? So if anybody wanna just state anything, what is planetary health among the audience? Wanna add something? What according to you planetary health is? Yeah, that's amazing. That's actually what we are talking about. We are talking about planetary health, planet. So we have everything on planet, right? So if we are going to discuss planetary health, we have to involve all these sectors, and this is what you are saying. So that's true. Anybody else? Yeah. Yeah, that's perfect. This is the basic fundamental, and this is what the friend said. This is what the working. This is how we works by the inter collaboration, and this is what the planetary for the basic purpose of planetary health is. So far, I just mentioned here that it is a transdisciplinary, and the solutions oriented frame. We need both these things. First of all, we need to realize why it is transdisciplinary. We need to inculcate every segment, every development factor in order to have a solutions oriented frame. First of all, we should have a collaboration, the transdisciplinary, and then we can have the solutions oriented frame. So there is a need to address the challenges of our time. In Pakistan, in my upcoming slides, I would discuss that why is it important in the reference of Pakistan, you know. So it is for the transformation to address the degradation of Earth's biodiversity, natural systems, its interconnected impact, and then we can have a single purpose that is shared planet. So for this shared planet, we have to be this topic discussed. So we can say that planetary health is a concept that encourages evidence-based policies, you know, to promote human health and prosperity while preserving the environment that allows us to thrive. So now, as I mentioned earlier, that youth is an important factor. So why youth and why youth advocacy for the planetary health? It's very interesting fact to know that around about 64% of the Pakistani nation is younger than 30, and 29% of Pakistanis are between 15 and 29. So that means we can have a huge impact. That means we can have the potential to address these issues more competently if the youth involved as a main stakeholder, and it is. And so, according to the 2017 Pakistan National Human Development Report 2017, these are the facts. So that's why youth in Pakistan. Now the challenges. Now I told you what is planetary health. I told you why youth in Pakistan is important for the planetary health. Now it is what are exactly the challenges there. So this is a simple findings that reveal that almost 29 out of 100 young people are illiterate. That means they don't have access to education, and we don't have access to them. We, we can't address them as I can address to the medical student in Pakistan. They know what's the worth of the healthcare system. They know what's the worth of planetary health. So ultimately, they can understand me better. But if I have 29 out of 100 young people illiterate, that means there is a huge, challenge for us. Then only 6% have more than 12 years of education. Another important, point to notice. Then 39 out of 100 are unemployed, are employed, but 32 of them males and 7 females. We have the gender gap to exist in Pakistan. Now, the 57 of 100 youth are neither working or nor seeking jobs, and only 4% are unemployed and actively looking for work. So these are the statistics for youth in the reference to the Pakistan, and these I can say the challenges, the real statistics figures. Now, as I said before, we have the gender gap challenge, the gender equality, then the significant gaps for social engagement and connectivity, So another factor is internet. We have the literacy. Now we don't have the internet connectivity too. So that again turns out to be a gap between the planetary health and Pakistan. Now 52% on a cell phone and 94% don't have access to a library. So that means what we are doing, if I'm making a research, I have published a number of articles that doesn't and that wouldn't make an impact in Pakistan because the students or the young people don't have access to library. Another turns out to be a major, you know, um, of challenge for us to bring this concept into the practical framework in Pakistan. Now we have the 93% lack access to the sports facility. So this is another factor that can, have a huge impact. Now, we discuss, what is planetary health, why youth, its challenges. Now, what is the need of planetary health? This is a very simple question. This is for I am here from all the way from Pakistan to US, and you guys are there sitting there. So what you guys exactly think about it? Like, is it the need of today, or maybe is it the need of future coming all the way? What do you guys think? You guys can have your input. Yeah, yeah, that's true. But still, we are, this movement is still in the preliminary phases. We still have to go very far, you know. So, yeah, the need of the yesterday exists. So, in the reference of Pakistan, we have recently, you guys would know that we have massive monsoon rainfall and the flooding all over the Pakistan. A very drastic flooding, one third of the Pakistan drowns. Around about 10 million plus children are out of school just because of the flooding. They didn't have access to the proper education. Still, they didn't have access to proper education before flood, but what infrastructure exists, it again disrupted out, in the flood areas. So it is neat. This concept, this green policies needs to be inculcated. Besides other factors, we can have the health threats, that is the spread of vector and the waterborne diseases. Recently in the flooding, one third of Pakistan is drawn, so that means we have the water everywhere. If we have the water, so what does it mean? Being the health professional, it means waterborne diseases, right? So this is what we have. Another, we have the outbreaks of the diarrheal diseases. We have the skin infections, respiratory tract, and the dengue. Still, we have, like, I'm from Lahore, so we have, I got a large break from the SOS International Harvard, and that was about dengue. So that means these challenges are still exist and still need our attention in reference to the planetary health. Now, so again, moving ahead, this is the questions I leave on the floor, where planetary health stands during health crisis. We are talking about the policy interventions, we are talking about the government interventions, we are talking about the courses, we are talking about the educational development. What during health crisis planetary health can play a role? What do you guys think about it? You know? Yeah. Yeah, you are right. The basic thing during the health crisis, the all the public are suffering from this crisis. So they're more prone to understand what we are saying, right? When they are in good health or well-being, or maybe we didn't have any health crisis, they wouldn't understand our words better because they didn't realize the word. Yeah, so that's fine looking valid. So a health crisis, what need to be done? What need exactly to be done? Being the young medical student and being the representation of, campus ambassador there of the Planetary Health Alliance in Pakistan, I really need to advocate for these issues, for the green policies. This is the really major concept, a really important concept, green policies, because we have policies exist, we have the framework exist, we have the, constitution, we have everything, but we need to rearrange them. We need to replace them with the green policies. We have the health infrastructure, but if we would align them green, we can have the better interventions, we can have the better patient-centered studies. It can turn out to be a huge impact in the coming future. So we have to develop the PH courses. As I have mentioned before, being the Planetary Health Campus Ambassador, I have been working on a workshop, today workshop. So, when I talk about my, with my colleagues about the planetary health, amazingly, they didn't know about it. So, I need to work from scratch. I need to work from the start. So I think we should have planetary health courses, and there must be a short courses there. So this can change impact and can sensitize the public. Then we can have the student workshops. These are the interventions I have been suggesting just on behalf of the medical student. So we can have the student workshops so that we can take a start for the better or the brighter future ahead in terms of the planetary health, so that we can move ahead to launching a degree in the planetary health, as a major coursework. Now, what should be our role? So our role exists as youth healthcare leader. You know, the leader is the one who gains respect within his fellows. So we should be a youth healthcare leader. If I am presenting there, if I'm attending this conference, if I got to know the works of the people from the different countries, how they are changing the impact, that means when I went back to Pakistan, when I go back to Pakistan, what would my major role there? There should be the healthcare leadership. There should be the advocacy. There should be the, just like I'm standing here and discussing this topic, just like I have to stand there in Pakistan and I have to raise there as a leader and tell them that this topic is a real concern for us, being in the Pakistan culture. Then we have the meaningful youth involvement. The youth can play their major role only when they have their meaningful engagement, when they have engagement with the perspectives beyond, when they realize about themselves and they moving to the mass community awareness. So this is where the ultimate goal stands. The one I'm standing here now, I'm sensitizing my colleagues, maybe 1 2 3 4, maybe more than that, maybe 10 plus. Now these 10 plus goal is to raise mass community awareness, right? So that we can have a huge impact afterwards. So yes, and at the end, create impact to do more. Now, ways to get involved are, these are some organizations working actively for the planetary health. This is slide basically to highlight the different organizations work, like the Planetary Health Alliance mentioned. Then we can have the Planetary Health Placement Organization. Then we have the Bridge Collaboration. So we can have, first of all, we need to know what exactly is. So just like I have been the ambassador, I get to know the different perspectives. I get to know, a chance to attend the Planetary Health Annual Meeting. So that means I'm going, my knowledge deep to this topic, to this concept. So before talking about it, I should have a deeper knowledge about, all by myself. It doesn't make any sense that I don't have a complete knowledge and I'm going to, I'm a healthcare leader, I'm going to everything, So that makes no impact. That creates no impact. So before that, before moving into the healthcare leadership or the advocacy or the meaningful engagement, you guys should have a proper source, proper resources where you guys should have to learn and then create impact. So yes, go green ahead. Thank you. So how much time we left? Yeah. So we can have a discussion over there if you guys like. What you guys think and you guys, yeah. You know what? In our university culture, these things, are promoted by our university administration. So I didn't face any such hurdle in organizing such workshops or doing seminars, webinars. Yeah, you know what? I'm just talking about. I am in Lahore. I am in one of the best medical university of Pakistan. You know, I'm studying there. So that means I am interacting with the healthcare, the better position holders, the professors, the PhD. So the guys know the worth what I'm doing, right? So I didn't face any such hurdle. But you can say when I went to the distant areas, maybe I found this one. So yeah, I couldn't face any such that keep worth mentioning. But yeah, that's central. Yeah, that's true. First of all, the public engagement you're talking about, right? So, what I'm planning to do is that to launch the Planetary Health Club. Maybe I'm planning to do that in my ambassadorship term this year, but if it wouldn't be possible, maybe in the next year. So once we have a club, we can open the membership call. So the members are going to engage with us, and once they get engaged, they are going to engage with our activities too, and might they become a volunteer. So this is how I would engage the public. First of all, medical students, then this membership open to all the public, then we can have a platform where we can discuss. So this is the club at my university level. We can integrate or with the regional hubs so that they can have a better exposure, and to ultimately to the planetary health license. So they can exposure to the annual meetings too. So uh, from the this is the way I can and I will engage the medical students on the campus. Yeah. Yeah, I just take your point. Mass community awareness. You are right, and the first point to raise is that we don't have resistance from the youth, but we do have when we went into the community level. So yes, that's true. We shall face, because in our community maybe some taboos or these kind of myths exist. So that makes them somewhat resistant to adopt new concepts or new interventions easily. So yeah, this is something to count on. during the whole process. And the second thing, community engagement, it let us to explore being the medical student, the interaction between the common general public, so we can have, we can have the seminars or the webinars where the general public is, invited, and we can design accordingly so that they can understand, particularly in Urdu, so the language barrier exists too. So yes, that's a good suggestion. Yeah, so what I was thinking that when we are advocating for the green policies, I think we should involve the community level interruption. When the public sports one idea, it can only turn out into a policy. Otherwise, there is no word of policy on a page of paper. So once the yeah, that's true. Thank you. Okay, anybody else? So for hey, how's you doing? So actually, my presentation sums up, but I can brief you in a nutshell, right? So it was about. So basically, I'm talking about the youth engagement. I consider it as a potential factor. Between planetary health in Pakistan. So the basic reason is that we have the 62%, people in Pakistan between the ages of 29 and 30. So that means if we are sensitizing this bigger ratio in Pakistan, we can have the major impact in the near future. So this is what the topic of discussion is. So I get to introduce some interventions, like the challenges being, youth involvement. 29 out of 100 young people are illiterate. That means it's a pretty, hard to engage them, or pretty hard to take them on board for this purpose. Well, we have another ratios, 4% are unemployed and looking for the work. So why wouldn't they care about the planetary health when they are unemployed and they are looking for the job? So these are some challenges regarding the youth engagement. Now, the next thing, why it is the need of planetary health in third world countries, and particularly in Pakistan? Almost it is a need of the world, but particularly in Pakistan, we have the number of challenges listed there. Recently, we have the massive flooding, and massive monsoon rainfall. So that will just sensitize our youth that why is it important. Now, the next thing we have, the number of public health threats, waterborne diseases, diarrheal outbreaks. Recently, we have the dengue one and the diarrheal diseases, cholera, and the management of the non-communicable diseases. So this is a point where we can sensitize the youth. We can, make them realize why is it important and why should have this planetary health concept inculcating in our not in our education system but in our policies, and we can have the interventions at the local level. So next, where planetary health stands during health crisis. This is an open floor question. If you guys wanna, give input on this question, you guys can. You know, like just think about it. You know what? My this presentation is for the population ratio that is not suffering from flood. You know, this is particularly for the professionalist, for the medical students in Pakistan, just like me. They are studying in the universities. They have all the facilities. They have a good exposure to the education. They have a good quality life rather than the population living below the poverty line. And the second point, you are good to go. In the flood, why wouldn't they care about planetary health? They didn't have a food to eat. Yeah. They didn't have a shelter to live. They didn't have their houses. We really have very adverse circumstances over there. So how would I engage them? So basically, first of all, they are not target right now. The target is the medical students, the professionalist, the one who have a good exposure. So in the upcoming future, or when they reach sustainability, or maybe recovery from the flood, they can be our targets. So I hope I can answer your question. If you have anything, you can just throw away. Yeah. You know, yeah, but I do mention mass community awareness, right? So, first of all, we need to inculcate these concepts, or to teach these concepts to the leaders, to the future leaders. Once they get, they can have the mass community awareness. So yes, it can be a future target. But for now, we are keeping this concept or this presentation to the medical students. I hope it clears out, right? Thank you. So now these are some interventions. I said green policies, planetary health courses, or the student workshops for the engagement. Next, what should be our role? Being the medical student, I guess the youth healthcare leadership is much more important. Once we have the youth advocacy on this concept, then we have the meaningful youth engagement, involvement, and ultimately leading to the mass community awareness. So these three steps, any student or medical, student can follow to have a greater or create impact in terms of the planetary health implementation in Pakistan. So these are some ways to get, involved. These are some organizations working for this cause and working, greatly. So these can be the platforms where we can, sensitize. We can use to sensitize youth so that they can, think globally, work locally. So this can be done through this. So yes, let's go green ahead. Okay, if you guys wanna give your input or anything else, you guys can, or any suggestion, any inputs, any comments. You know, yeah, the one of the challenge Pakistan is facing is food security. And despite the challenges of climate crisis, we got immense increase in this. The importance of these challenges. So yes, the green policies is important, and it is important for the food security as well. So yes, being mentioning there in my presentation is just to sensitize the youth that to realize their importance. Because once we get to know about it, if I'm saying I'm standing there, most of the people in Pakistan didn't know about the green policies, this concept. So yes, this is not only important in terms of the food security, this is important in terms of any other challenge, because we have policies exist, we have the framework exist, we have the working exist, but there's a need to turn them into the green, the sustainability, to increase their sustainability. So yes, this is important. I hope I answer your question, right? Yeah. And you mentioned anemia too, right? Yeah, so anemia, thalassemia, these are some really, really biggest challenges of Pakistan, and they exist. They do exist. I recently have an internship over in the thalassemia center, so I get to know, I use this platform to engage with a person suffering from them, and you are going to amaze that around about 1600 are thalassemia carriers in Pakistan. So that means we are a greater impact, a greater threat to Pakistan population. So yeah, so far their green policies implementation too. So yeah, this is also important there. Yes, welcome. So, there are many reasons for this. First of all, I'm a medical student. I'm a medical student, so I can have my influence on my circle, right? In my friend circle. So this is what can I do in my capacity right now, being the second year medical student. So I can engage my fellow medical students with me. I have different platforms for them. The second thing is that the medical students is going to be the future healthcare leaders. I'm going to have a patients from the different areas of Pakistan. I'm going to have a different relations to the different healthcare professionals. So they are going to have a huge circle of influence in the coming years, right? So they are, if they know this concept, that means they're going to create an impact in the future, or maybe now, or maybe in the near future. So that's why I'm really focusing to the medical students particularly. And the third thing is that I mentioned green policies, right? So if I'm a second year medical student, maybe in the future I'm going to be not as such my plans, but maybe the government or in the government representation of the healthcare system. So if I'm knowing the importance of this important concept, I'm going to propose the policy and maybe the green policies in the upcoming years. So this is where my topic of discussion stands for the medical students. They are going to have a huge impact in the upcoming years. So if I'm sensitizing them through my presentation, that means yeah, I'm doing something. I'm really doing something. So that's the reason I am targeting medical students particularly today. I hope I answered the questions. Okay, great. Besides that, you guys can have I'm talking about in reference to Pakistan. You guys can share yours, like in the different countries, how it went, the youth engagement or particularly planetary health. You are saying that if I have case studies or framework studied from like different countries. You know what? First of all, the basic framework that I really want to discuss, I really want to share the United Nations. Recently I have stated the statistics from the United Nations Human Development Program. So before going or studying into any case studies, I really prefer the United Nations. So I have studied them, but ultimately depends on the situation or the scenario case where you are implementing them, and ultimately it turns out to do some change in that framework. Particularly, I recently don't have any, particular framework implementation, but in the future, it must be when I have the planetary health clubs established in on my university with some, active members, then we can go ahead with any framework, particularly to implement with all its objectives and goals, inshallah, in the near future. So yeah, I hope it answered your question, right? Great. You know what? I attended the volunteer congress, in Pakistan. We have a person, I didn't remember his name. You know what? We have a complete the particular working. They have a huge impact by collecting the blood, and donating the blood. So it is working closely with the United Nations. So we have a huge whole fundamental, they have established different centers for this particular cause in the different cities of Pakistan, and they are working closely with the United Nations. And this particular person was, I guess he has been working with the United Nations, its related committee. So yes, we have the implementation of the framework in that particular scenario, the anemia or blood related. So we have the particular framework exist, and it has been implementing, and it has an impact. They have shared us the complete presentation over there, and it receives a recognition from the different national ministers, so health ministers. So yes, we have for the anemia. This the framework I'm talking about, it is not about the nutrition, it is about the blood. Okay, it is relating to the blood donating, or maybe the blood collecting. So this framework exists for that particular case. For the nutrition, I didn't know exactly about it. Yeah, I didn't know. Yeah, I'm just can I ask your profession? Are you a nutritionist? No. Okay. You can share yours. I would love to hear from you, but still till now I really don't know about it's proceeding. Maybe we have, but yes, I can say one thing very accurately, that yes, this challenge exists. Yes, this challenge like highlighted again and again in our local or the national newspapers or in our discussions. But the regarding the framework, I couldn't say anything with accuracy. Yeah. So that's all. Okay. Anybody, anything else? Yeah, thank you. Okay, if you guys don't have anything, so we can sum up this discussion, right? Is it? Okay, yeah. So thank you. Thank you everyone for being there in physical or in virtual. Thank you everyone.